I'm Corinne Schuster-Wallace. I'm a water health researcher and I'm co-chair of the Working Group on Climate Change and Health under the Canadian Association for Global Health. I'm joining you from the University of Saskatchewan in Saskatoon. We're located on Treaty 6 territory and the traditional homeland of the Métis. The offices for the Canadian Association for Global Health are located in Ottawa, which is on the unceded territory of the Algonquin and Anishinaabe people. I invite everyone within and outside Canada to reflect on the First Peoples of the lands and waters where you live, work, and learn, and the importance of valuing our lands and waters as important for our ongoing health and well-being. As you're aware, many of you, the Canadian Association for Global Health is relatively new. It's resulted from the amalgamation of the Canadian Coalition for Global Health Research and the Canadian Society for International Health. The working group was established in 2018 in recognition of the need to enhance climate change-related knowledge and capacity among global health researchers, practitioners, and decision makers. And so the webinar series is a core activity of the working group. And you'll find recordings of previous talks along with links to resources provided by speakers on our webpage under the CAGH website. And there will also be links to reports, including the IPCC 6th assessment on the website. And I believe it's going up in the chat as well. So today, I'm absolutely delighted that we have a panel discussion with authors of the IPCC's 6th assessment report. As a contributing author for the first time, I can say that there's a tremendous amount of work that goes into each of these reports. And I really appreciate all of the work that these panelists and others have undertaken to make sure that we're all aware of the current state of evidence when it comes to climate change and the urgency that's needed to address climate change. Today, each panelist will present for about 5 minutes, followed by a moderated panel discussion. And then this will be followed by an audience question and answer period and an evaluation poll at the end of the webinar. We'd really appreciate your feedback at the end as we continue to shape the webinar series, particularly under the newly formed CAGH. So please, if you can give us another few minutes at the end, we'd really appreciate your feedback on that. And feel free to share your questions at any time in the chat box. You can also reach out to our team at any time using the chat feature if you require any technical support. And so it's now a great pleasure to introduce a friend and colleague, Dr. Sherilee Harper. Dr. Harper is a Canada Research Chair in Climate Change and Health and an Associate Professor in the School of Public Health at the University of Alberta. Her research investigates weather, environment, and health in the context of climate change, both in Canada and internationally. And she frequently collaborates with government and community partners to prioritize climate-related health actions, planning, interventions, and research. In addition to her many publications, she's contributed to a number of important national and international reports and policy documents that include serving as a lead author on the IPCC's 6th assessment report. And I really appreciate her bringing together everybody for this panel today. And she's also been a lead author on the IPCC's special report on the ocean and cryosphere in a changing climate. So Sherry, over to you and our panelists for today. Thank you very much.
Thanks so much, Corinne. I'm so excited to be here today. Lauren, if you could advance to the next slide, please. Okay, perfect. So yes, good morning, everyone. Thanks so much for joining today. As Corinne said, my name is Sherilee Harper. I'm joining you from Treaty 6 territory in Edmonton, Alberta. Right now, I'm specifically located on the lands of the Papastu people. I'm so excited about today's panel. I feel like we have an all-star team of IPCC authors here today to talk to us about the topic of global health and how we can try to mobilize some of the results from the IPCC 6th assessment into global health action. Next slide, please. So to get us started, I just wanted to mention the importance of the topic of climate change as being a human health issue. Historically, climate change has been considered more of an environmental topic or maybe an infrastructure topic. But increasingly, I think that there's more and more awareness that climate change is actually a human health issue. And this can be really helpful in terms of spurring on action. In fact, there has been some research coming out of the United States showing that if you frame climate change as a health topic, that it can inspire more action than framing climate change in other ways. So for example, there's been studies that looked at framing climate change through a security lens or through an economic lens or through a health lens. And when you compare these, the lens that inspires most action tends to be through a human health lens. And that is exactly our topic today, is climate change and global health. Next slide, please. So we're talking about the IPCC, one of the IPCC reports. So the IPCC was created in 1988, so quite a few decades ago, by the World Meteorological Organization and the United Nations Environment Program. The objective of IPCC is to provide governments at all levels with scientific information so that they can develop climate policies. And really critically is the IPCC reports provide really key input into international climate change negotiations, including the annual climate change COPs, which one is coming up in a few weeks in Egypt. And so the IPCC is an organization of governments that are members of the UN or the World Meteorological Organization, and currently has about 195 members. There are 3 working groups for the IPCC, which produce 3 reports in each assessment cycle. So working group 1 focuses on the physical basis of climate change, looking at how the climate has changed and how it could change in the future. Working group 2 looks at how those climate changes impact society and how we might be able to adapt to some of those changes. And working group 3 looks at how we can mitigate climate change and how we can, reduce our emissions to prevent further warming. And so today we're specifically looking at the working group 2 report, which focuses on impacts and adaptation. Next slide, please. So this report was released in the very end of February. And it's a huge amount of effort, as Courtney had said. The report cites over 34,000 studies, and there were 270 authors from 67 different countries from around the world, 41% of whom were identified as women. And it's a rigorously reviewed report. And I think that this is something that not a lot of people realize, is the peer review process that goes into this. So there are 2 official public review stages where any expert from around the world can register to be a peer reviewer of the draft versions of the reports. And for the working group 2 document, we had over 62,000 comments submitted by reviewers that we had to respond to. And we have to respond to each and every single comment. And all of these comments and our responses are publicly available. So it's a very rigorous and very transparent process. And, I have to say that of any paper that I've ever published through the peer review process, I can very, very confidently say that the IPCC review process is probably the most rigorous peer review process that I've been through. So it produces this really robust document, and from which we create the summary for policymakers. And the summary for policymakers is approved line by line by these 195 countries or member states. And that's it's a high stakes process. And it's a high stakes process because the summary for policymakers and the report underpins international negotiations on climate change at the climate change COPs. And so governments come with a lot of questions. They ask authors the questions. They ask authors to clarify the text. They ask authors to strengthen the text. And we go through this back and forth process line by line until the summary for policymakers is approved, which means that the underlying evidence in the report is approved. And that also signifies that these 195 member states agree with the science that's presented in the IPCC report, and sort of makes an unofficial good faith commitment to act on the evidence that's being presented. Next slide, please. So I think that this quote really summarizes some of the key findings of the report, and that's that the climate is changing. There's serious impacts. We can adapt and there's solutions, but we really have to act now. Next slide, please. And so the report covers both slow onset changes, so things like sea level rise, gradual warming, ocean acidification, permafrost thaw, and things like that, but it also covers climate and weather extremes. And in Canada, we're definitely becoming increasingly familiar with those. So that includes things like the heat dome that we experienced the summer before last, flooding, droughts, and other extreme weather events. Next slide, please. And these climate changes have really wide sweeping impacts on humanity. And they range from infrastructure impacts, cultural impacts, economic impacts, basically everything that we care about. And of course, today, what we're focusing on is how it impacts health. Next slide, please. And these impacts, of course, are not equitably distributed. And the sixth assessment report from Working Group 2 for the very first time outlines and names explicitly how things like colonialism are at the root causes, or one of the root causes of climate change risks, and also underpins our ability to respond to these, or hampers our ability to respond to these. Next slide, please. And of course, these things impact the health of millions of people around the world. And the report covers a range of impacts from foodborne and waterborne and other infectious diseases. It covers impacts on nutrition, maternal health, and child health. And for the first time, the sixth assessment report also assesses in detail the impacts of climate change on mental health. Next slide, please. And we cover not just the impacts, but also the solutions that are available. And we know that adaptations can reduce health risks, but we know that adaptation efforts are not evenly distributed, and they tend to be more in the planning stages and not in the implementation stage yet. And we also know that as warming increases, these adaptation efforts will become less and less effective with increased degrees of global warming. Next slide, please. And so, the report really highlights the importance of acting now. And one thing that we have coming up in just a few weeks is the climate change COP27, which is hosted by Egypt this year. And this is the annual climate change meeting where all the different UN member states come together to negotiate different climate change topics. This is where the Paris Agreement was first agreed upon, and this is where the member states come back to further discuss this. Make other agreements through coalitions of the willing, and basically talk about all sorts of climate change issues. And that's the focus, one of our focus of today, is how we can use the IPCC report to provide evidence and inform the discussions that are happening writ large at COP27. So with that, next slide, please. There's my contact information if you're interested. And I think that now we can turn it over to our speakers, which I'm so excited to hear from. So our first, I'm going to read the speakers' bios, and then we're going to turn it over to them to present some of the key findings that they felt were really important to highlight from the sixth assessment report related to global health and decision-making. So the first speaker is Dr. Kris Ebi. She's a professor in the Center for Health and Global Environment at the University of Washington. Her research focuses on understanding sources of vulnerability, estimating current and future risks of climate change, designing adaptation policies and measures to reduce risks in multi-sector environments, and also estimating the health co-benefits of mitigation policies. She's supported multiple different countries from around the world in assessing their vulnerabilities and implementing adaptation policies and programs. And she has hundreds of publications. She's probably one of the top publishing authors in the world on climate change and health topics. And of course, she's a lead author. No, she's a review editor on the IPCC sixth assessment report. And she was also one of the authors on the summary for policymakers for the Working Group 2 sixth assessment report. It's a great honor to have Kris here today. We also have Craig Brown. Craig is he's the climate change and health lead at Vancouver Coastal Health, where he supports climate change adaptation projects in the health sector with an emphasis on community collaboration. He's an associate faculty member at Royal Roads University in the Master of Arts in Climate Change Action Leadership Program. And he's also an author on different national and international climate change assessments, including the IPCC sixth assessment report. Next, we have Debbie Lay. She is an economic affairs officer of the Energy and Natural Resources Unit in the UN Economic Commission for Latin America and the Caribbean. She is a doctor of philosophy and geography and the environment from the University of Oxford. And she also has an MSc in civil engineering from the University of Colorado Boulder. She's worked in a number of different roles, including as a consultant for a number of different organizations, focusing on topics ranging from renewable energy, energy poverty, rural electrification, sustainable development, and climate change mitigation and adaptation. She's also a lead author on the IPCC sixth assessment report from Working Group 2 and a summary for policymaker author. She also volunteers for Engineers Without Borders, Sense and Sustainability, and she's an editor for the Journal of Regional Environmental Change. Like I said, it's an all-star panel of speakers, and we'll turn it over to our first speaker, Kris, now, just to provide an opening statement. So Kris, please, welcome, and over to you.
Thank you very much, Sherilee. And just to make everything confusing in the IPCC, I was a lead author on the human health chapter. So anyway,
multiple roles.
Multiple roles, and a contributing author to the summary for policymakers. I would like to start with the United Nations Framework Convention on Climate Change. This was signed in 1992 by all the world governments. The ultimate purpose of the convention is to prevent dangerous anthropogenic interference with the climate system. And this is the core of the negotiations every year at the Conference of the Parties. And understanding what is dangerous and what can be done to prevent further hazards from occurring for health, for livelihoods, for our nature. And this is what frames then all of the assessment. When we look specifically at human health, there were some real advances this year over earlier years. The first is there's a field of study called detection and attribution. And that field of study does exactly what it sounds like. It detects whether there's been a change, there's been a trend in some climate sensitive health outcome, and then determines the extent to which climate change contributed to that change, that different trend. And there's now detection attribution studies for health. And from those studies, we can say that people are now dying from climate change. The evidence primarily comes from heat, but it also comes from some work in Canada on Lyme disease. There was a 43-country study that used modeling to try and answer this detection and attribution question. It's a complicated set of analyses. That concluded that about 37% of all heat-related mortality over the last couple of decades is actually caused by climate change itself. These are real people in real communities. When you look at the numbers in British Columbia from the heat dome, there were, I think, close to 800 deaths. I'm sure Craig will give a better number than me, that were caused by climate change. And that's really important. So we now have this evidence. We had new evidence, as Sherilee mentioned, on mental health. We had new evidence on heat and how heat is causing adverse pregnancy outcomes. So we're adding new vulnerable groups to our long list of vulnerable groups. There was also quite an advance in looking at projections at what could happen under different assumptions of development and of climate change, under different greenhouse gas emissions. And those all indicate two things. One, the risks are going to continue to rise. And the second is the extent to which those risks arise will depend on how quickly we mitigate and how quickly we adapt. The more we invest in increasing the resilience of our health systems, the more we reduce our greenhouse gas emissions, including from our health systems, the lower the risks are going to be. The risks will not be zero. We will continue to have what we call our residual risks. So we're going to see higher heat-related mortality in a changing climate, but it doesn't have to rise dramatically. With that, I think I will, one other comment I wanted to make. There's quite a strong assessment, both in Working Group 2 and in Working Group 3, of the health benefits of mitigation policies and technologies. That most of the mitigation policies are good for our health. They, as soon as they're implemented within a very short period of time, will reduce avoidable hospitalizations, avoidable premature deaths. And so we do have the evidence on the mitigation, as well as the evidence of all of the ways to strengthen our health system. Thank you.
Thanks so much, Kris. And yes, Kris has been part of the IPCC process probably since the very beginning, but definitely at least, if not for most of the assessment cycles. So yeah, it's such a pleasure to have you here today. Next, we'll turn it over to Craig. Craig, over to you for some opening remarks.
Thank you very much. It's great to be here, everybody. Thanks for making the time. I'm speaking today on the traditional territory of the Coast Salish people, specifically the Songhees and Esquimalt nations, in what's known as Victoria today, and where we're eagerly awaiting rain. I'd love to talk more about it, but there's emergency operations centers being created on the Sunshine Coast to address a real risk of a hospital there not having adequate water. This is again unprecedented territory for us, which seems to be the way we're living now. Anyways, I was involved as a contributing author in the North America chapter, which is a fairly minor role, but still I got to glimpse just the behemoth that is this assessment process, and like Sherilee said, the rigor and the transparency that goes into it, which is, I think, like a core driver of its value for someone like me, who's largely a practitioner. I wanted to say that I came about that role as a result of being a coordinating lead author in Canada's National Climate Assessment on the Cities and Towns chapter and on the British Columbia chapter. And I just wanted to say to those of you that are maybe eager to get involved in this process, I got at it as a contributing author to the IPCC chapter just as a result of asking. And I suppose I got the CLA roles in the national assessment just as a result of asking as well. So don't be afraid to put yourself out there and say what you want, and you never know what might happen. So I contributed in the North American chapter to the cities, settlements, and infrastructure section. So I was kind of actively encouraged not to produce too much health-related content because that was going to appear elsewhere in the chapter. I believe Sherilee probably led and created most of that content, which is superb and which has benefited Vancouver Coastal Health and various other health partners in British Columbia directly. So just a very quick overview of my role. I'm a climate change and health lead. There's now going to be several of us, one of us in each of the regional health authorities within British Columbia, which is fantastic. This all started from the Health Adapt project that Health Canada funded, where we were encouraged to build our capacity in climate change and health adaptation. I'll say that at the beginning of that, back in 3 years ago, September 2019, there was still a need to build political will really quickly to convince internal champions and senior leaders that this really was a key public health issue and health system risk. And although the AR6 wasn't out at that time, IPCC reports, the Lancet and others were key in unlocking that political will. For us in public health, there's pre-heat dome and post-heat dome. Kris mentioned it, but it was an unprecedented, hugely impactful event for British Columbia. And what it did is actually it generated a lot of activity, so much so that many of us in this space, our heads are kind of still spinning. But what it meant is that now more than ever, we needed to take an evidence-informed approach. And so even, on a regular basis now, we do touch back to the North America chapter, the Health and Wellbeing chapter, as well as Canada's National Health Assessment and others, just as a way to make sure that we're orienting in the best way, that we're thinking, that we're circumspect about the risks that we face, say from extreme heat. It's just really useful for us to have a place where we can go quickly, that we know is rigorous, transparent, and tries its best to be crafted in a way that can, support our decision making and our policy creation and all the rest of it. So having content on food security, on mental health and wellness, on Indigenous impacts and adaptation, these are things that we have thought about and we've done some of our research from September 2019 onwards. But with the arrival of the Working Group 2 AR6 report, we were able to kind of reinvigorate some of those findings or pressure test them in a way, and really to just refine our thinking on climate change and health adaptation. So I think that the last point I would say is, and I'm going to speak, we're going to have some time to just discuss later, but I think it's helped us be a better collaborator too, just putting us in touch with other professionals in the area and experts, but also helping us think about, the health system here. The health system is really complex. And so seeing how it's described in some of these reports helps us refine our thinking and show up with a more articulate position of us as public health practitioners and how we fit into this big complex space. So I'll leave it there, and I look forward to more of our discussion in a while.
Thanks so much, Craig. And, and thank you to you and your team for all the work you do. British Columbia is definitely known as a leader in the climate change and health practitioner space in Canada. So yeah, thank you for everything that you guys do. Now we'll turn it over to Debbie. Debbie, the floor is yours.
Hi, how are you? Thank you very much, Sherry, for this very kind invitation. It's great to be able to speak with all of you. So I think I'm probably the only one not joining in from Canada. So I'm right now in Guatemala with a majority of Indigenous Mayan population. And I've mainly worked in rural communities with them. And so in the past 3 weeks, we've had 2 hurricanes, Ian and Julia, come by here. I know some of those also got, I believe, to Canada. And it really highlights how vulnerable the population here is, especially the Indigenous population. So, I think that one of the things that struck me most of this AR6 is that there seemed to be an increased focus on systemic vulnerabilities. So yes, we have these climatic vulnerabilities, but what is the role of poverty and inequality, the lack of or poor governance that some of these populations face, and how, despite adaptation options that we can implement, there will still be vulnerabilities if these other systemic vulnerabilities are not dealt with. So I think that it is important to keep that in mind, especially as we talk about how to help the poorest and the most vulnerable. And something else I think that is important to mention, besides the part of colonialism being a driver of vulnerability that Sherry mentioned, is also that we discuss how the lack of basic services and infrastructure is also a barrier, and that in fact the provision of these basic services and infrastructure are an adaptation option. So I believe that is very important, and that it helps open up more funding, because, for example, rural electrification is traditionally labeled as sustainable development or poverty alleviation, without really considering that when we talk about, for example, early warning systems or disaster risk management strategies, we need energy. Even when we talk about health and emergency care programs, we need that energy. So to be able to actually say that these basic services and infrastructure are important and that they help for adaptation, I believe is also important for these populations. So I was in the special report of global warming at 1.5 degrees with Kris, and we started developing this multidimensional feasibility assessment. And I think that what I like of this framework is that it allows us to go beyond the usual focus of the economics and technology and look into the institutional and social cultural aspects, also environmental and geophysical, where we can look at what's the political acceptability, what are the transparency mechanisms, legal and regulatory frameworks that can enable or provide a barrier for a specific option. But also when we move into social cultural, we get into social acceptability issues, inclusiveness, equity. So right now we have, for example, intergenerational equity and gender equity. And even though there are other types of equity, we could not include them because IPCC is based on peer-reviewed literature, as Sherry mentioned, and all the literature that we viewed. But what I believe is most important in this framework is that it is flexible in that even though we did it at a global or regional level, it can also be done at national and subnational levels, where each country or municipality or whatever the subnational level is, can include indicators that are important to them. So for example, here in Central America, we would include Indigenous knowledge. Maybe in Guatemala specifically, working in rural populations, we would include Mayan cosmovision. and how traditional Mayan knowledge is included in the implementation of these options. And just lastly, within AR6, I was in the climate resilient development chapter. And climate resilient development, I think, is a very nice way of ending my statements, in that it talks about how we bring together mitigation and adaptation in the support of achieving sustainable development goals. And I think all of the previous speakers mentioned how these impacts and risks that we're facing are tied to global warming levels. So that means that the measure in which we reduce emissions will also dictate how we better adapt. But we also need to look at how different mitigation measures also have trade-offs for adaptation and that increased risks, including for health. So while we also look at what are the different co-benefits of adaptation measures, mainly measured through the different sustainable development goals, there are also areas where there are trade-offs that we need to pay attention to. Something that was distilled from the feasibility assessment, for example, was that most of the options, I'd say 90% of them, had a clear, strong, and positive nexus with the health SDG. Actually, health and clean water SDG 6 were the two that appeared as constant, followed by sustainable cities. So that's also something important to keep in mind. And that as we talk about climate resilient development, we also need to talk about ethics, equity, justice, and inclusion, so that an adaptation option in and of itself is not sufficient. And that just as to close, that the IPCC report does provide a lot of information and knowledge, as Sherry said, for the negotiations. But we must not forget that we also need the wisdom to make ethical decisions. Thank you very much.
Thanks so much, Debbie. And I mean, I think that you really beautifully summarized one of the key findings of the report from a health perspective, and that's that, you know, while we can find a lot of solutions, whether it's adaptation or mitigation within the health sector, there's a lot of health benefits to be gained from outside of the health sector, from food, from water, from transportation, infrastructure. All of these things have health implications, health benefits, or health impacts. Wonderful. So now what I'd like to do is I'd like to pose a few questions to our various panelists. And I'd also like to encourage everyone in the audience to think of your own questions for this all-star team of panelists. Feel free to put your questions into the chat box or raise your hand to ask some questions. So to get started, I'd like to start at a more local level. And I'd like to start with you, Craig. And I was wondering if you could draw on your experience as a leader in climate change and health action within Canada, particularly through your role with Vancouver Coastal Health. And I was wondering if you could share why it's so important for public health units or the health system more broadly to implement information from IPCC reports or other assessment reports. And you know, what do we have to gain now or in the future? And do you have any ideas on how we can better support the use of these reports in actual action on the ground at a local level?
That's a great question. Thank you. So I guess one of the ways I'd answer that question is that it's really important for us to get this as right as possible. I don't think, you know, you don't want to let the great be the enemy of the good, but reports like this help make sure that we're heading in the right direction with our decision making, because we're asked to do a lot of things and there's a lot of intuitions about what we ought to do in terms of public health and climate change and health adaptation. And they're well-intentioned, but we need to take an evidence-informed approach. And so I think by focusing on actions that are identified in reports like this, we can make sure that we're on the right path. So that's, I think, one of the important aspects of this. Another is that it probably helps us reduce our blind spots. So we think we know what we're at risk of and what we ought to be thinking about, but certainly, you know, content from the North America chapter, from the Health and Wellbeing chapter, continue to influence our thinking on this and to refine our thinking. It also provides us, with just, I think I mentioned it before, but having something that we can use as like a credible touchstone when we need to convince folks or when we want to be a little more persuasive, or we're in a climate where we need to be a little more persuasive, it really helps. I think that the understandings of future risk too, these reports, we can't always model or understand our future risks. It can be quite difficult to do that. And so having, again, this evidence base that we can draw on these assessments is really, really useful for us. I think it pushes us too. One of the notes I have is that you come into contact with all sorts of best practices and examples of actions. And for us, again, we've got a climate change and health adaptation framework that we developed, but that doesn't mean we know exactly what we ought to be doing. And so I think that, when there's a table of adaptation options, that's something that jumps out immediately for us is, oh, okay, great. Here's some things that other locations are doing and things that we could consider doing in our context. And so that really helps us as public health practitioners and helps us know that we're on the right track. I think in terms of how we can improve or better support their use, this came up recently in terms of the national assessment. A planner from Vancouver Island kind of mentioned that he doesn't read the report when it comes out, but he needs to know where it exists. He needs to be able to access it quickly, and he needs to get the information he wants out of it very quickly. And I would say that process, as a user of these reports over the years, has really improved. It's fairly easy now to get to the landing page for the Working Group 2 set of reports. It's fairly quick to get into it, see the table of contents, some of the key messages. So that's great. Because for some of us, and certainly some of my senior leaders, there just isn't the time to dive into this. And so I think that continuing to deepen their usability is good. There were some Twitter threads that came out when the reports were released that really helped folks orient themselves. And I don't want to be the infographic guy, but they did. They do really help us when we're super busy. And I think the last thing I'd maybe say is that as a user, we use these as part of a suite sometimes of products, like along with the Lancet reports, along with the National Health Assessment here in Canada. And that suite of information products is really, really powerful for us. So maybe there's a way to leverage that in future releases, and maybe that's been done, but just to raise that as a possible source of value. So I think I'll leave it there just to make sure there's airtime for everyone else, and happy to jump in more later.
Thanks so much. Yeah, and climate Twitter is very active, and I love that space. And yes, the suite of tools that IPCC doesn't just produce the report. There's all sorts of other supporting materials around the report that are available for people to use. Thanks so much, Craig, for that locals perspective. And now I'd like to zoom out, because COP27 is literally weeks away, just around the corner. And so I'd like to turn it over to you, Kris. And I was wondering, from this more international perspective, Kris, you have been, as I said, a key actor in the IPCC process for a very long time. So I was wondering if you could comment on why it's important for global health content to make it into the COP27 discussions this year. And are there any promising signs that will actually happen this year? And what more can and should be done to support those discussions at COP27?
Thanks, and it's another great question. I'll go back to something I said earlier. The core of the negotiations is around preventing dangerous anthropogenic interference with the climate system. And so the more that we have the health message, the more that countries understand that health is central to what they do on climate change. There's been a lot of success in that area. Every country that's a signatory to the Framework Convention on Climate Change has to produce regular national reports. Countries now also need to produce nationally determined contributions, and these are their contributions to reaching the goals of the Paris Agreement. When you look at these, primarily from low and middle income countries, 3/4 of all the countries list health as one of the primary sectors, which is a big shift over a decade ago. So now countries generally recognize that health is a big challenge. The main problem we have is under the Framework Convention on Climate Change, there's 4 adaptation funds. And when you look at those adaptation funds, less than half of 1% has gone to health. And so countries are simultaneously saying we've got challenges with climate change and health and are getting no support, financial or human support. So the more that this information comes forward, the more important it's going to be to get funding to be able to increase the resilience of our health systems. One of the critical discussion threads that's going to happen at this COP is something called loss and damage. And this comes from low and middle income countries with their frustration on the very limited flow of money into adaptation. There was an agreement 15 years ago that by 2020, there'd be $100 billion per year in adaptation funding. That has not been delivered. What's being delivered is tens of billions of dollars every year. And so now we've got loss and damage, and loss and damage is a place where health also needs to play a critical role, showing in fact that people are dying from climate change and that countries really have to have the investment urgently and immediately to be able to start managing the risks that they're facing, acknowledging that those risks are going to continue to grow. And to do it, as a handoff to Debbie, in a way that increases climate resilient development, recognizing that all sectors interact, and we have to take systems-based approaches to understand solutions that will be more effective over the longer term.
Wonderful, thank you. And yeah, let's stay at that that international level, and that segues really nicely into my question for Debbie. So Debbie, you have a lot of experience doing climate change work with the United Nations and in other international collaborative spaces. So I was wondering if you could comment on why it's important for different actors across different sectors, organizations and countries to come together and work together to mobilize some of these system transitions that are needed to support global health and to make sure that health is supported intentionally when it comes to climate change. And I was wondering, like, how can we achieve this realistically? Like, what realistically needs to be done to help us get there?
Thank you, Sherry. So I think that the first question is easier than the second one, but the systemic approach I think is very important, because I think we've all increasingly are recognizing that we can't work under just sectoral vertical silos where one sector doesn't talk to the other. Because even, for example, when we talk about, say, clean or more efficient cook stoves, you need the ministries of energy, environment, health, and forestry, just to mention a few. But really, at least in Central America, for example, that mix of institutions does not happen. And the forestry people will look at forests, the health will just look at the particulate that are, the particulate matter and so forth. So that is one reason why we can't progress. The other one is because when we're looking at specific options, we never implement one adaptation option in isolation. We might plan it in isolation, which is what usually happens, but that option will have an impact on other options and so forth. So, for example, when we work in Chapter 18 under Climate Resilient Development Pathways and in system transitions, is realizing what are these interactions. And specifically with climate change, when we're talking about my work, for example, at the United Nations, even though there's a specific climate change unit, I think we need to realize that climate change will impact economic development and commerce and international trade and energy and social development. And that the activities of these other units will also impact emissions levels. So these are not topics that we can work in isolation anymore. One way that we talk about climate resilient development is that the way to achieve this integration of mitigation and adaptation to support sustainable development is through societal choices. So that means that each and every person has a role to play in different arenas or spaces of engagement. So we're talking about countries, we're talking about civil society, scientists, the private sector, even the media. And What I think is also important to add is that when we're talking about where you implement projects, it's very important to gather information on the perceptions and expectations of the users. You know, sometimes we implement projects that at the end aren't used or aren't used adequately because of different perceptions. You know, it happened to me working with Mayan communities, for example, into how they view solar energy and the relationship of those solar panels with nature, which is something that we maybe from the outset wouldn't look at. So this part of perceptions and expectations of what people believe in, I think is important. So how do we make this happen? I'll go from bottom up, in that the most vulnerable and marginalized people really do need to be listened to and be part of these conversations, whether at the project specific level and how finance is managed, and even in negotiations, like in the upcoming COP. How much voice do we actually allow them to hear? Because I think the other point is that, as Kris mentioned, we need the more financing, and more financing had been pledged. It hasn't materialized, but we also need to realize that despite that more financial flows are important and needed, we also need them to be effective, and that more financial flows can also lead to more maladaptation and more poverty and more injustice if we don't manage them correctly. And we've seen that as proof in the previous years. Thank you.
Thanks so much, Debbie. And now we're going to open the floor to all of you, all the audience members, to ask questions of our panelists. We have a few in the chat, so you can either enter your questions into the chat, or you can use the raise hand function to raise your question and ask your questions for the panelists orally. Since I don't see any hands raised quite yet, we'll go straight to the chat box. With our first set of questions. I'm going to ask them in groups of questions, and then I'll ask the panelists to respond briefly to them. So the first question: is there any systemic analysis of the socioeconomic determinants of health and how they relate to unequal adaptive capacity to the impacts of climate change on health? Another question: how is the relationship between socioeconomic determinants of health and adaptive capacity translated into the IPCC report? Let's start with those two questions, and then we'll go back for more. Panelists, would anyone like to respond to that one?
I'm happy to start with that. The IPCC reports are mandated to be comprehensive. And that's why you saw the numbers from Sherilee on how many papers were cited in the report. So the answer is yes. If there's literature related to climate change, it has to be assessed. And there were chapters in the report that focused on adaptation. There was chapters, also text boxes, and all of the impact chapters looked at adaptation. And so it is a bit scattered in this report. It was more focused in the last assessment report. But what information is available was assessed and is in the report. And as you imply by the question, absolutely socioeconomics is critical to understanding the capacity of communities to manage our changing climate, and that we know that the socioeconomic determinants of health are critical to track and to inform decisions that are taken in adaptation and in mitigation. And as Debbie said, to ensure that the decisions taken, the actions implemented, reduce inequities around the world.
Yeah, thanks so much, Kris. And what I think I'll do is I'll jump to the next question, because I think the next question, all of the panelists will probably have a lot to say on. So the next question from the Delaware School of Public Health asks, in your opinion, is it truly possible to reconcile the need for radical action aimed at mitigating climate change and a growth-centered agenda, well exemplified by the SDGs, built on a global economic system that is at the same time actively destroying the biosphere while failing to meet the basic needs of the majority of the world population? And how? It's a big question, and I'm sure there's lots of different angles you could take this in, panelists, but your thoughts on that question?
So I can start with this if it's okay. So really great question. And I think that the climate resilient development pathways help in this direction, because when we look at what are the dimensions of development, like well-being, low poverty, ecosystem, health, diverse knowledge systems, we're trying to move away from this economic or GDP-based growth into more of what are the different types of values. And I know that this is an IPCC panel, but I'm just going to make a small parenthesis here, that IPBES, the Intergovernmental Platform on Biodiversity and Ecosystem Services, just published a report on values assessment, looking at the non-economic values of, for example, nature. And that is also being adopted in the new IPBES assessment on Nexus. It's called the Nexus assessment, which looks at the same time at biodiversity, health, climate change, energy, food, and water, and which also adopts part of the climate resilient development pathway. So I think that it is possible. We have a small, as you mentioned, the urgency, the closing window of opportunity before we reach limits and options are not available. But I think there is a growing recognition of these non-economic values. But I think what's also needed is the political will, and again, the voices of everybody asking for that and fighting for that. Thank you.
Wonderful, thank you. I'll pop to another question. Okay, so this question comes from a recent graduate of the Master of Public Health program at King's College London. The question, have you seen any effective ways to collaborate amongst ministries for climate resilient health systems? As you mentioned, the importance of working between ministries. Craig, I imagine that you have something to say about that in your own work experience.
Yeah, absolutely. This has been a really edifying and exciting part of our role. I think even 3 years ago, the health system was thinking about climate change and health adaptation, but it hadn't become formalized. There hadn't been governance processes created. And I think, again, the extreme heat events of June 2021, the release of BC's climate preparedness and adaptation strategy really led to, well, in our case, $13 million over the course of 3+ years to kickstart work at the ministry, work at the regional health authorities, First Nations Health Authority, BC Centre for Disease Control, and others. So this really is kind of the health system in British Columbia. There's all sorts, like BC HARS, the Heat Alert Response System, is just one example of how all these entities now are coordinated, taking action in unison. It's really great to see. And I think it's tough to figure out where we all fit in, who should lead on a climate resilient health system approach, for example, what role the WHO framework could play. We've done a baseline assessment. There's all sorts of stuff that we can share, and I'd encourage you to get in touch. But that's their necessity is the mother of invention to some degree, or certainly necessity is the mother of political will in our case, and the money helped. There wasn't as much money as we had hoped, but those collaborations are underway. I think they're really effective. Of course, we need more, but we're on the path.
Wonderful. And I'll take one more question, but I want to encourage the audience to continue to put your questions into the chat. We'll collect them and circulate them to the panelists and share answers with you later. So the last question from the audience that I'm going to take right now is responding to one of Debbie's comments. So she says, Debbie, great point on the bottom-up approach, especially inclusion of the most marginalized population in the process, decision-making and fund flow. Any changes have been made or suggested solution in this regard, or where are the entry points to start? There's a lot of talking, but a lot of action so far. And this idea is something that I definitely heard a lot at COP26, the focus on a lot of talk, but where's the action? So panelists, what's your response to this question?
Well, I'll start here. And thank you for another great question. I think one of the starting points, but not the only one, is that COP27, the IPCC report has garnered a lot of attention, including starting from the subsidiary body negotiations in June in Bonn, where there was a lot of attention to climate resilient development. And this is one of the messages that was put forward, including how the different adaptation funds referred to can include this. But I think that each one of us in our own work has a role to play. I know that there are other fora in which, you know, it's always mentioned that, oh, you need to have these huge amounts of emissions reductions to really make an impact. But in reality, what we find in IPCC is that every action matters. I think it's one of the key messages of SR 1.5, that every 10th of degree matters. So whatever we do within our communities, our families, our workplaces, really impacts. And if it's within our hands and within our work to be able to give one community of vulnerable or marginalized people more voice, I think that should be counted as success. And meanwhile, I think that forums such as this one, where we can share these results, are also important. And yeah, you can trust on us, I think all of us, to continue nagging the respective folks on taking more pointed action. Thank you.
Kris or Craig, anything to add to Debbie's comment?
It was a great comment. The only piece I would add is to look around and see how much change is going on. That we see things happening today that wouldn't have happened 5 years ago in both adaptation and mitigation. That people tend to lose hope when they look only at the national government, but look at what cities are doing. Mayors are putting pledges forward on net zero. There's been an enormous amount of change. And industry also is doing an enormous amount of change. Boeing, based in Seattle, is doing test flights right now of electric planes. That technology is moving forward in ways that will dramatically reduce our emissions. And we need to celebrate all of these changes and help others not only understand the science, understand the urgency, but also understand the transitions are already underway. And everything that we can do, as Debbie said, to facilitate that, we should.
Thanks so much, Kris. And thank you so much to all of our amazing panelists for taking the time out of their very busy days to spend this time with us. I'm really excited to see what happens at COP27, and hopefully we'll see global health on the agenda and part of the discussions that are coming forward. And for me, I think a key take-home message from this discussion that we've had over the past hour, as well as from the IPCC 6th Assessment Report, is the urgency, the message of urgency, and the idea that every decision that we make today will take us further away or closer to a climate resilient future. So with that, we will close for today. I'd like to thank the panelists, but I'd also like to thank Mail from the Healthcare Excellence Canada for providing the tech support and helping organize this session with me today. I want to thank everyone in the audience for taking the time out of their day to attend now, and also to thank those who are watching online in the future. Before you go, please do fill out the evaluation poll that will help us improve these sessions in the future. So thank you all so much. Have a great day and enjoy the rest of your week. Thanks so much, everyone.